Hi, my name is Madeleine Tait and I'm a musculoskeletal and sports podiatrist in London, and today I'm going to talk about metatarsalgia, which is a generic term for pain in the ball of your foot. So this can be caused from inflammation and an overload of the tissue in the ball of your foot. It's often thought to be as a result of increasing load through this part of your foot. It could be an injury to the bursa complex, the neuroma complex. We also have ligaments in the ball of your foot that can get injured, and bones and bone stress injuries as well. So it's worth seeking a medical professional or medical help, such as a podiatrist, to get to the bottom of your diagnosis. And there's also some causes that could be biomechanical, so how your foot and ankle is structured. So a bunion or a hallux valgus, for example, will change the loading pattern across the rest of your foot. Hammer toes and claw toes, these can increase the load through the metatarsal joints and the ball of your foot as well. Muscle strength, so we've got lots of muscle tendons in our foot, and if these get weak or tight, that can increase the area of load as well. And a particularly high arched or low arched foot type will dissipate the load as well. So it's worth seeing a specialist to come up with a reason why this might be an injury you're experiencing. So symptoms of metatarsalgia. So metatarsalgia is often described as pain in the ball of your foot. It can be interdigital, so between the metatarsals or on the metatarsal itself. And my patients will often describe that they've got burning or aching pain in the ball of their foot. Sometimes they feel like they're stepping or walking on a pebble, or something's in their shoes. They might get some numbness or tingling. And it's often that athletes or runners might experience pain or widespread pain across their foot. So it's most common to have a pain that builds up over a period of time rather than a particular incident that causes the pain. So diagnosis of metatarsalgia, often a clinical diagnosis with a podiatrist like myself can help come up with a management plan for you that would help with your immediate pain relief and return to sports and exercise. However, if we see a need for interventional radiology, we can look at an ultrasound scan, which can provide further details of what's going on in the ball of your foot. An X-ray can look at the bone health, so look at the metatarsals and check if there's any bony injury or stress fracture, and an MRI as well as necessary if we're seeking further full view of what's happening in the middle of your foot. Treatment for metatarsalgia. So we can look at lots of different treatment modalities for you, bespoke to whatever is going on for you when you're experiencing this. Often this will involve immediate period of rest, so a period of time where we can ensure you can be off your foot, or particularly just take a little bit of time off some of the high impact sports and exercise that you're doing. Some people find some ice or takes a bit of pressure off as well and helps to calm down this area. Changes to your footwear, so making sure that you're wearing some cushioned and appropriate shoes for you that actually fit you as well. And we'll discuss all sorts of sports shoes, work shoes, day-to-day shoes, as well as what you're wearing around the house. Orthotic therapy, which are medical devices that go in your shoe. These can be really helpful for pain in this area, and often we need to make some additions and make them customized to you based on the biomechanics and how you're moving, to really help with offloading this region of your foot. And this will come down to sort of further assessments, looking at how you're moving to really come up with a plan for you. We'll also look at an exercise-based plan for you, so we'll make sure that the muscles in your foot and ankle and up towards your knee are firing up appropriately. There's also non-steroidal anti-inflammatories and injection therapies that can be useful, and we can discuss this as well. If you're experiencing metatarsalgia or would like to discuss this further with me, please do make an appointment, and look forward to seeing you soon.